Osteosarcoma is a rare bone cancer involving osteoblasts, the cells that lay down new bone. While osteosarcoma is relatively rare, it is important because it is the most common primary bone tumor in children and young adults. In this mnemonic, we'll cover everything you need to know about osteosarcoma come test day. Welcome to the old shipyard, where legends come to train for their biggest feats. There's plenty of open space, but you gotta watch out for the flotsam that washes up like these giant shark bones. By the way, these giant shark bones are our symbol for osteosarcoma, since the word stem osteo just means bone, and shark sounds like sarcoma, or sharkoma. Osteosarcoma, you feel? Let's start with the pathophysiology of osteosarcoma, for which we'll have to take a look at the concrete mixer. Wait, that guy. Is that really the Bruce Lee? Must be him. Anyone else roundhouse kicking the cement mixer would get a misdemeanor for vandalism. But for Bruce Lee, it's just warm up. That cement overflow looks like it'll be a pain to clean up. By the way, this uncontrolled overflow of cement from the cement mixer represents malignant osteoblasts laying down bone in an uncontrolled manner, resulting in osteosarcoma. What was an osteoblast again? Recall from physiology that osteoblasts are the cells that produce bone. More specifically, they produce a substance called osteoid, and that osteoid is later mineralized into bone. At Pixorize, we use wet cement to represent osteoid. So cement mixers therefore represent osteoblasts, because osteoblasts produce osteoid. Got that? And what happens to wet cement after you pour it? Well, it hardens into concrete. And by now, I think you probably see where this analogy is going. After osteoblasts produce osteoid, the osteoid is then mineralized using calcium, thereby forming mature bone. So, wet cement hardening is our analogy for mineralization of osteoid to form hard bone. Finally, this cement mixer is out of control in laying down cement. This is appropriate since we're talking about osteosarcoma, a malignant bone tumor in which cancerous osteoblasts are uncontrollably laying down new bone. Interestingly, we can measure this increased osteoblastic activity with an elevated alkaline phosphatase 2 to 3 times its normal value, since alkaline phosphatase is an enzyme that plays an important role in bone mineralization. Now that we know how osteosarcoma happens, let's talk about its clinical presentation. Here at the shipyard, legends not only train, but also love telling legendary tales, especially to the young. You can see this old man telling a story to the young boy right now. Their age difference will help you remember the bimodal age distribution of osteosarcoma. The young boy and old man represent the two most common age groups to get osteosarcoma: adolescents and adults over 65 years old. This bimodal age distribution is seen because osteosarcoma is really divided into two groups: primary and secondary osteosarcoma. Primary osteosarcoma means that the tumor originates from the bone without pre-existing bone conditions. As mentioned earlier, osteosarcoma is the most common primary bone cancer in children and young adults. This peak age makes sense because it overlaps with the pubertal growth spurt, when osteoblasts are naturally more active. In contrast, secondary osteosarcoma describes the cancer being caused by something else, usually by prior irradiation, Paget's disease of bone, or malignant transformation of benign bone conditions like fibrous dysplasia or chronic bone infections. Elderly patients are more likely to get secondary osteosarcoma, since, well, you need to live a long time to get a disease caused by another disease, right? The elderly legend is still telling his story. Let's listen in. Turns out that pile of shark bones aren't flotsam. It's the aggressive shark that attacked this man. This aggressive shark can help you remember that osteosarcoma is a very aggressive tumor that progresses quickly without treatment. Clinically, osteosarcoma presents as bone pains that can be mistaken for growing pains. The rapid growth and worsening of the tumor in a period of months can point to its aggressive course. Luckily, primary osteosarcoma tends to respond to treatment, which includes surgery and chemotherapy. Secondary osteosarcoma, however, has a worse prognosis. While the old guy had the last laugh, it seems the shark managed to take a huge bite out of his leg, up to the knee. He's got a peg leg now. held in place by that knee brace. This location of the knee brace coincides with the most common location of osteosarcoma, around the knee. Osteosarcoma usually occurs at the metaphysis of long bones, like the femur or tibia. Wait, say what? Yeah, the metaphysis. Recall that long bones are made up of three parts: the diaphysis, the metaphysis, and the epiphysis. The diaphysis is the long bone bit, and the epiphysis forms the caps at the ends. Sandwiched in between is the metaphysis, which I like to think of as the growth plates of bone. Since this is where the new bone is laid down to lengthen the bone, osteoblasts are naturally more active here. As such, it makes sense that osteosarcoma, a bone cancer involving osteoblasts, are generally found in the metaphysis. Specifically, the distal femur and proximal tibia around the knee are the most common sites for osteosarcoma. For test day, just think of this man's knee brace, holding his peg leg in place to remember that the distal femur and proximal tibia around the knee is the most common sites for osteosarcoma. Time for the story's grand finale. How this legend got his glass eye. It was the shark as well? This glass eye is our symbol for retinoblastoma, a cancer that predisposes one to developing osteosarcoma. Retino in retinoblastoma refers to the retina in the eye, making this glass eye perfect for helping you remember the eye cancer retinoblastoma. Retinoblastoma is a childhood cancer of the eye, typically caused by an inherited genetic mutation of the retinoblastoma gene. Is it just me, or is that glass eye looking at me? It's giving me the heebie-jeebies. Let's move on to the other predisposing factor. For that, let's return back to the Bruce Lee. Bruce Lee has been training so hard these days, he hasn't had a chance to get a haircut. Now he's sporting what looks to be a fro. You know, short for afro. This Bruce Lee fro will remind you of Li-Fraumeni syndrome, another predisposing familial cancer syndrome. Li-Fraumeni syndrome is a cancer syndrome by an inherited mutation in P53. P53 is an important tumor suppressor gene, so its mutation causes patients to develop a lot of different tumors, including bone tumors like osteosarcoma. You should watch our video on Li-Fraumeni syndrome if you haven't already. For now, just remember Bruce Lee's fro for Li-Fraumeni syndrome in osteosarcoma. Before we wrap up, let's go over the imaging findings of osteosarcoma. This is how the exam writers will test you here, so pay attention. We are at the shipyard, so it's about time we talk about that sailboat. By the way, this triangular-shaped sail can help you remember an important pathological sign of osteosarcoma on X-ray called Codman's triangle. Codman's triangle describes the appearance on X-ray of an osteosarcoma growing such that it lifts the outer periosteal membrane away from the bone, forming a triangle. So when you see a sail-like Codman's triangle protruding from a long bone on X-ray, think osteosarcoma. It looks like we've been training and swapping stories for so long that the sun is beginning to rise. You have to admit, it's a pretty spectacular sunrise, a sun bursting above the ocean. This sunrise, with its rays extending outward, is here to remind you of the sunburst appearance that osteosarcoma is visualized with on X-ray. This sunburst pattern occurs when the bone cancer grows too fast and the periosteum, or outer covering of bone, does not have enough time to lay down a new layer over the tumor. So, instead, you get fibers of collagen and bone growing out perpendicularly, like rays of the sun. Hence the name, sunburst pattern. Both the sunburst and Codman's triangle are high-yield imaging findings you should really associate with osteosarcoma on test day. Now that the sun's risen, it's time to seize the day. I feel inspired to do some training as well by watching another video. Let's recap this one first. Osteosarcoma is an aggressive bone cancer of osteoblasts, or the cells that lay down new bone. Osteosarcoma has a bimodal distribution. Primary osteosarcoma is usually seen in young adults, while secondary osteosarcomas are seen in the elderly. Osteosarcoma generally occurs in the metaphysis of long bones, and especially near the knee and the distal femur or proximal tibia. Imaging findings include Codman's triangle or a sunburst pattern on X-ray. Finally, osteosarcoma is associated with familial retinoblastoma and Li-Fraumeni syndrome, both cancer syndromes that are highly associated with bone cancers. That's it for osteosarcoma. I hope it's smooth sailing for test day.